Hello, let's talk about the question of the USMLE medical ethics. The question number one about the brain death. As you can read the question, an 80-year-old man is admitted to the hospital with a massive intracranial bleeding inside the brain. He has been placed on ventilator because of the respiratory failure associated with intracranial herniation. When you try to remove the ventilator, there are no respirations. The patient makes no purposeful movement. There's no pupillary reaction when you shine a light in his eyes. There's no nystagmus on cold caloric question testing. Ocular cephalic and corneal reflexes are absent. He has left no specific wishes for his care. The question is, which of the following is the most appropriate action regarding this patient? A. Remove the ventilator. B. Make the patient a DNR. DNR means do not resuscitate or do not save. C. Place a nasogastric tube to prevent aspiration. D. Get a court order authorizing you to remove the ventilator. E. Do an EEG or electroencephalogram 3 times separated by 6 hours each time. So, as to this question about the medical ethics, which one should we choose? Well, the patient meets the criteria for brain death, since as we can read that the negative corneal reflex, no nystagmus in response to caloric stimulation of the tympanic membranes, and negative pupillary and ocular cephalic reflexes, and the absence of spontaneous respiration when the ventilator is held. So if there are no brainstem reflexes and the patient will not spontaneously breathe, then the patient is brain dead. They're brain dead. The patient is dead. There's no hope of recovery in this circumstance. And an EEG is not necessary because the clinical presentation is clearly consistent with brain death, which is a legal definition of death in the United States. Maybe this time the heart has continued to beat. Maybe it is the same as like taking the heart out of the chest in the same it beat in a specimen pen, simply because of the automaticity of the heart's intrinsic conduction path. But the patient is dead. So when the patient is brain dead, you do not need to seek court or ethic committee approval prior to stopping all therapy. When a patient is brain dead, do not place a nasal gastric tube for feeding or hydrate the patient or give the water or fluid to the patient. The brain dead patient is dead. This would be as illegal as placing a nasogastric feeding tube in the cadaver or the autopsy table. So, to this question, we choose choice A. But by the way, but please remember, although you have legal right, as a doctor, you have the legal right to turn off the ventilator immediately on a person who is brain dead. But you should talk to the family first. If there is an answer, let's say that discuss or conference or in other words, indicating that you want to always achieve consensus first, then that is the best answer, but there's no such answer given. And the boards would greatly prefer examinee discuss the matter with the patient's family first prior to remove the endotracheal tube. So that is the analysis of this question. Thank you.